some recent research shows that there are long-term effects of getting a meniscus tear in your knee. And I thought this is important to bring this information to people, because sometimes people get a meniscus tear in their knee and then they don't do the right things about it early enough. And they go on suffering, they go on dealing with the problem. And I want you to let you know that that is the wrong way to go about doing things. It doesn't mean you should go out and have a surgery. Your body can heal and repair itself. There's other things you could do. There's regenerative medicine, there's modalities, there's therapies you could do to help your body heal and repair. But the research is coming out that says if you get a meniscus tear, it significantly increases your risk of getting arthritis in your knee. So what happens is the synovium, the part of the tissue in your knee that produces synovial fluid, is there for cushioning repair, gets a little inflamed. Then it creates an inflammatory process in your synovial fluid. And because of those inflammatory processes, it actually stimulates your body to cause degeneration in the joint. Bone spurs and things like this occur. So just having a meniscus tear doesn't mean that that's all you have. It means that you have a high likelihood, or a much higher likelihood of developing arthritis in your knee down the road. So what do you do about it? My suggestion, again, I don't know you, so I'm not giving you medical advice here over the internet, but would be, if you get a meniscus tear, do everything you can to get your body to heal and repair that on its own, and get that inflammatory process to reduce as quickly as possible. Now, some people will take that and say, oh, okay, I could do a steroid shot that will reduce the inflammation. I would caution against that, generally speaking. And again, no medical advice here over the internet to anybody as an individual, but cortisone shots are the fast track to joint replacement. That's the research is equivocal on that. Is cortisone shots will speed up the degenerative process. So that might not be the way to go, but you can look at doing stem cell. You could look at doing PRP, platelet-rich plasma, prolotherapy, and there's a lot of other modalities that can be done to help stimulate the repair of the tissue in the knee joint without you needing to go and potentially without you needing to go and get a surgery or a surgical repair for that meniscus. Even if you did have to have a surgical repair, those modalities and treatments will help speed up the healing process and potentially help limit or mitigate the scar tissue and adhesions that come from the surgery that can then lead to arthritis down the road. So if you damage your meniscus, get on top of it quickly. Don't just sit on it and wait for hoping that it's going to go away on its own. Do something about it as quickly as you can, and do everything you can to avoid the medication side of knee pain treatment, as well as the surgery side. Surgery can be needed, medication can be needed, but there are other modalities that are out there in the research that are showing to have significant impacts on the improvement of things like a meniscus tear or even other ligament tears. Again, full thickness tear of an ACL, might need to get that surgically repaired, right? But if it's a partial tear, there might be other things you could do. You should research those things, like I was talking about, PRP, stem cell, and other modalities. Anyway, I hope you found this helpful. Take care of yourself. Make sure you keep your own knees, all right? You don't need to have them replaced too early. Sometimes people need to have them replaced, but you don't want to do it too young. Take care.